Welcome to the Heart of Health Equity. My name is Ashlei Rodgers. I'm the host of the show. And today I have an amazing, amazing guest, Dr. Kyu Rhee, who's the Senior Vice President and Aetna Chief Medical Officer at CVS Health. Welcome, Kyu. Go ahead and introduce yourself.
Thank you so much, Ashley, and thank you to all your listeners. It's a pleasure to be here. I'm excited for this conversation.
I'm excited to have you. Thank you so much for being here. And so as I ask all my guests this question, what does health equity mean to you?
To me, health equity is a foundational element of everything I've done in my career. And I think it's something we can all understand personally, as well as hopefully professionally. I've had the privilege of seeing that firsthand as a primary care physician. I've had the privilege of seeing it from a public sector perspective as a public servant. And then most recently, in two private sector settings, I've learned that public health is foundational to what the private sector can and often does deliver.
You've done some really impressive things in your career. Like, can you tell us about what are the other companies that you've worked for? Because you have extensive experience in the public and private sector, and let's just talk about that.
I had a very impactful experience at a place in Washington, D.C., near where I grew up, Christ House. It was over there in Adams Morgan, and where I saw doctors living in the same community as people who are homeless in a shelter setting, and were providing care, breaking bread together. And it impressed me that there was so much good work in what's known as federally qualified health centers, and the care that they deliver, and how they thought holistically about health with healthcare. And so I had an opportunity to make the shift to the private sector, where I was a little worried and concerned, but I felt that IBM was a company with strong values, a long history, and had done impressive work in terms of leveraging technology to improve many industries. And I think health and healthcare is an important industry where technology has such opportunity. And then most recently, nearly a little more than a year ago, was really privileged to come to CVS Health and be the Aetna Chief Medical Officer, because I sincerely believe that the team we have here, the assets we have, is not only transforming health today, but is moving to where health and healthcare is tomorrow.
And so because you have lived, right? Like you look young and fresh, but you have lived and you've done a lot of different things. Can you tell me about some of the biggest challenges that you've experienced as like a public health expert working in corporate America? Because I know you're probably working with colleagues who don't fully understand the nuances of so the social determinants of health, or what health equity really means. Like, what are some of the challenges you've experienced?
I would suggest that one of the concerns that I've had in my experience in both in three sectors, nonprofit, public, and the private sector, is that many of the leaders often don't understand other sectors, or don't I'd go as straightforward as trust the other sectors. So the networks that I built in the nonprofit and the public sector are different, frankly, than the networks I have in the private sector. But the excitement is where I see, where there's trust brokers.
Can we talk about the trust factor? Like, how are you helping build trust within all three different worlds, because you're working in these spaces?
I just think there's so much more in common than different. And you realize that health and healthcare is a team sport, not only at a micro level, when you're talking about, like, I as a primary care doc, would typically have a medical assistant, a nurse, a pharmacist, a social worker, a psychologist on the team, your registration staff, your call center staff. It's typically 7 to 8 people who are associated with every primary care doc, who are delivering team-centered care. So that's a team sport right there. And often trust with a patient or a family was brokered with the diverse members of that team. It wasn't just me who brokered the trust, but often a nurse or a pharmacist might be the catalyst of trust. And as a result, that patient trusted the whole team. And so at a macro level, when you look at the ecosystem of health and healthcare, I call it the 7 Ps. If you look at how the decisions, the money, and the data flows, it's from a patient to a provider to a payer, to a purchaser, like an employer, then to a policymaker, and then a product manufacturer. And then pioneers, I like to say, like you and like many people who watch your program, you're looking to be pioneering and entrepreneurial about how we should look at the system. You know, some of that is in settings like this, or academic institutions or startup companies, but there are a lot of folks who are looking to, you know, to push the envelope and ask what could be, not just look at the way things are. So I think of that broader ecosystem as a team sport as well, those 7 Ps.
I mean, this is the first time I'm hearing about the 7 Ps, but I like them. I was just like, ooh, this is really like a great way to remember all the players who are in every sphere of like healthcare or any decision-making process. So I'm writing that down. So I'm taking that with me. I hope you don't mind. And so we've talked a lot about health equity and social determinants of health. And I know you've been in spaces where you've had to have tough conversations about race and inequality. Like, what is your approach to having those type of conversations? Especially, you know, as another person of color who's in these higher level positions, like what's your approach?
The often statement I would often reference that I had, even I remember as a child, you know, people would, you know, at the time, the representation of Asians and Asian Americans were Bruce Lee and Long Duck Dong from 16 Candles. And I remember being, you know, kind of one of the few Asians in my class in elementary school, and being, you know, mocked in different ways with accents or karate chops, or you know, the way Long Duck Dong would talk. I remember that being very hurtful, and not understanding it. And then I remember my dad and my mom telling me, look, I mean, this is the best country in the world, but issues like racism and discrimination exist. And so, you know, in many ways, you've got to decide how you're going to handle it, right? I mean, you control how you react. So I remember initially, in fact, I got into a fight with one of my best friends. He was making fun at the time. I thought he was my best friend, but he was making fun of all these Asian stereotypes. And then he punched me really hard. And I remember thinking, oh my God, this isn't worth it. You know, whatever I'm doing isn't working. And then reflecting on that and saying, look, I'm going to look at it a little differently. I'll be passionate about what I believe or what I feel or what I sense. And I'll be open to meeting people where they are. Some people are at that early stage where they're asking you. In my mind, I feel like the early stage folks are like, oh, I know a lot of Koreans. Oh, do you know this person? Or, you know,
It happens to us too. That makes you feel better.
like, oh yeah, and you know, Kim Lee. I'm like, oh no, it's not like we have a club, but I appreciate you being curious. And then people go down different paths, and they're going to, you know, food and culture, and there's curiosity.
Mm-hmm.
I've just like been like open to all of it now because I want to meet people where they're at. But it's hard. I mean, when you think racism or inequality is you feel it's part of a key decision,
Mm-hmm.
it's hard to understand it or know how to address it. And look, it's clear to me when I look at the rooms I've been fortunate to have access in, much of it because of my parents as immigrants fighting for my brother and I, for our education, for the opportunities we have. But, you know, my dad did tell me very early, he said, look, if you're compared in general, you're going to have to be this much better in order to have the opportunities you have. Because if you're this close, often they might not choose you. They'll, you know, and I know Asians, we're often viewed as foreigners in this country, even though this is a country of immigrants. And so, you know, part of me is like, sometimes I wonder if that's part of what led to that decision. But if you let that eat you up inside, it's not worth it. You know, think positive intent, meet people where they're at, and try to go on this journey. Think on behalf of my daughters, right? I worry about them. I mean, they're women of color, which I think is a lot harder. Yeah, there's, you know, these are tough conversations, and I'm far from perfect in having them. But I've definitely learned a lot and will continue to learn. But I do notice that I'm often the only person of color in many rooms. And it makes you even more sensitive to how you wonder, you know, how you got there or how we got there. and how you have to be very careful about not making a mistake so that you might be eliminated from that room, right? So
first, thank you for being so candid about that. And it's interesting because I know for Black folks, we have the talk, right? But we never really think about the other groups of color who have to have the talk with their kids too. Like your parents obviously had the talk with you because you were dealing with other racial stereotypes or having to navigate the world in a different way than, than others. Can you tell me about what real progress looks like in health equity at CVS?
yeah, so CVS Health is already doing many amazing things in health equity, and our commitment to health equity is, I say it has to be foundational to anything and everything we do. So, from the supply chain to the communities we serve, I think in one area that we all are aware of during this pandemic is vaccine equity. And I think a big reason why we've helped advance vaccine equity or COVID testing equity is because we were very purposeful about the locations and where we wanted those vaccines and those tests to be. We looked at communities that were socially vulnerable to promote more awareness about vaccines and testing. And so I think when you have those locations that people see, and you have people in those stores that are brokers of trust, often, and that represent the populations they serve, that you can really deliver health equity. We also have a great report that we just published, a corporate social responsibility report that looks at the 4 areas that we're committed to: a healthy business, making sure we think about health and what we sell, our commitment to a healthy workforce, but also the people we serve, our clients, and making sure they're getting health and obviously connected to our business. A healthy planet. So our commitment to recognizing, addressing climate change and knowing that often impacts health disparity communities the worst. And then a healthy community with some of the initiatives of Project Health and Health Zones, and just embedding health equity into our business, I think is so foundational. We were the first national health plan in 2002-3. You can Google it, Wall Street Journal and Dr. Jack Rowe, to collect race ethnicity data from our members because we wanted to track the health disparities that exist, the racial and ethnic disparities, and then leverage those to actions to reduce those disparities.
That's amazing. I'm happy to hear that companies are not just doing lip service, because you're working for Aetna, which is a huge company, and CVS as well. So I know they're joint forces. With the data that you've collected, are y'all democratizing the data with some of the smaller organizations that don't have the resources to do the research?
I like to talk about data where we are and where I think it can go. And I think we're at the early stages of where it can go. So I put it in a binary area. And part of this is my experience at IBM.
Yeah.
And so look, data privacy and security, when we talk about trust, there's nothing more important than the privacy and security of your data, especially health and healthcare data. Knowing my medical conditions and what meds I'm taking, and it's harder to address that, right? So data privacy and security is a key part of trust. But what I often talk about in this new age of big data is that you want to move towards what I would call data philanthropy. Data, as you mentioned, is something that should be democratized.
Yeah.
But once again, that democratization of that data has to be with my consent, my awareness. And this idea that I have data, and I witnessed this a lot at IBM, where there are people and families who talked to me directly and said, look, I've got a debilitating chronic degenerative condition. I'm going to die in 2 years, cancer, autoimmune diseases, multiple sclerosis. Can you take my data and do something with it? So you might discover something that'll help others with this condition, this idea of data philanthropy. The future I think of is similar to how I can go when I'm able to start to drive, and I think about my 2 daughters. I'm scared of them driving right now, but they're only 13 and 11. But when they're able to drive and they can go and make a decision. I want to donate my organs when I'm, which, you know, I'm an organ donor where I encourage that. Organ donation is so important. But
Yes.
can I donate my data while I'm alive? And also maybe when I pass, because that data can be so powerful to leverage for real world evidence and to do better discoveries. Many generations are very comfortable with sharing their data in turn, they get value from it. And in turn, they have a sense that it's helping others, which I think is data philanthropy. And I think in health and healthcare, there's so many opportunities for this. And you know, we're excited to be leading. One area in equity is clinical trials.
Yes.
When I worked at NIH and I saw the lack of diversity in our clinical trials and looked at our health disparities, health equity strategy, we spend so much money trying to recruit people from health disparity communities so that the clinical trials represent the people they're meant to serve, whether they be drugs or procedures or interventions. And it wasn't being done successfully in terms of representing the populations you serve. You look at the US population, we're 40% minority. Clinical trials often, many of them still have like 5%. So a lot of work there to think about how data could be leveraged in a way that can lead to decentralization of clinical trials, democratization of clinical trials, and improved access to clinical trials, especially for health disparity communities. And that's an area we're working on in a very strong way at CVS Health. We're thinking about our retail footprint, the trust we've brokered in those communities, especially since this pandemic started, and how we can now provide better access to clinical trials across the country.
So can you talk about why diversifying clinical trials is such a hot topic right now?
So clinical trials are science and hope, if you think about the role that clinical trials play. To me, and part of me thinks about this personally with my father, before he died, right before the pandemic, and he was struggling with metastatic prostate cancer. And so he had the more traditional treatments to treat his prostate cancer. But when those don't work, you go into clinical trials often. You're looking for hope. You're looking also to contribute to the acceleration of science. And so I was relatively savvy. I could look up on clinicaltrials.gov. I could look at PubMed and publications and find out clinical trials or studies, or find out people who were doing studies for the type of cancer he had. And I helped provide him access to some treatment options that extended his life, probably another 6 to 9 months.
Wow.
But you know, a lot of people don't have access to that. They don't have the literacy or the expertise or the resources, right, to know how to navigate that. So we need trials that represent the people we serve. Perfect example of this is how I learned heart disease. You know, the idea of a heart attack being a man with crushing left-sided chest pain. That's the typical representation of, and I live not too far from Framingham, the Framingham Heart Study, where so much of the early science was focused on 70-kilogram men, because there was a perception that we needed to recruit men more than women, because there was, you know, I would almost argue a level of sexism, but the women had these hormones, that estrogen, and it would impede in our assessment of the clinical trial. So as a result, many of us have learned heart disease from more of a male paradigm of crushing left-sided chest pain, while we now know that women experience heart disease differently, with generalized fatigue, malaise. This is the whole American Heart Association Go Red campaign. And so if you don't include diversity in the clinical trials, the findings you have will only represent the people for whom that trial was designed for. And as a result, the science that's built, the hope that's built from those clinical trials isn't being delivered to all of America. We in healthcare have a lot of looking in the mirror and self-reflection we have to do about the role we played in enabling and allowing health disparities to proliferate and exist.
Right.
And we have a lot of trust to build with communities, particularly communities of color. So we have to go at this with a lot of humility and understanding and listening. But if we don't get our clinical trials representatives of the people we serve, that science, that hope is not going to serve all Americans.
Yeah, I agree. And first, I'm sorry about your dad because I know that's hard. I lost my dad in 2020 as well, so I get it. But for those, because you do have the literacy, like you know how to navigate the healthcare system and finding studies for your dad to join. For those who may be dealing with other rare diseases or not really know how the system works, what can they do? Like, how can they advocate for themselves to maybe be a part of some of these trials that may extend their life or the life of their loved ones?
Yeah, so this is where I think of the that ecosystem I just referenced, or your team, your team. So everyone should have a primary care clinician. They should have someone who's advocating for them holistically. And so in my mind, often your primary care clinician can help you navigate, especially in these crucial moments of health. My general advice is that those two stakeholders, need to be someone you trust. Everyone has a choice. You can choose your doctors. Don't feel like you're stuck. You can get second opinions, and you can change doctors. But asking them, are there clinical trials, is one way to kind of help have you navigate. I will tell you, the way the government is set up, clinicaltrials.gov is a public website where you can put in, the condition, the location, any factors you need, and you can see, what's available, what's currently recruiting, what's not. I do worry a little bit that, sometimes the literacy there for average Americans, you need someone to help interpret, right, what you're looking at.
Which is unfortunate. I don't know why they don't want to make it in more lay terms so the average person understands it. So they can know, like, do I want to join this or is it something that fits my needs,
Yeah, and this is one of the challenges we have in healthcare. Health literacy is often underappreciated. And for many Americans, it's like going into a foreign country where, everyone else speaks a different language. This idea that we're already a trusted place for people on their journey for health and wellness, I think we can be brokers of advancing health literacy with our health hub concierges, with our minute clinic nurse practitioners, with our pharmacists. People see their pharmacists 8 to 10 times more often than their doctor.
Yeah.
That trusted relationship can be so important. So anyway, so many opportunities to address health literacy. And I definitely think there's a significant overlap with health literacy and health equity.
Oh, 100%. I agree with that. And I'm happy to hear that you guys are working on improving that for so many communities that you're working with. Okay, Q, so I have a question. Of all the things you've learned thus far, what would you tell your younger self to either avoid or to do more of, or what have you?
Look, I think the pandemic made me realize a lot of things that I value, like equity, like mental health, like prevention, like family, the simple things. And I've told this to other folks who are dealing with, that caregiving generation where they're worried about their parents and their children.
Yeah.
And I have to admit, I loved IBM for a decade. It was great. I learned so much.
Yeah.
But one of the things that I missed out on was, with all the travel, I missed out on some of those simple moments. Going to India, 10 times was exciting, but actually after a while, it wasn't as exciting. Yes, FaceTime helps a little bit, but it's not the same as being there with your daughters and seeing them, play, right? And even moments where my dad was closer to the end of his life, where maybe I didn't have as many of those moments, with family. So I tell people, my team, like, family first, right? But ultimately, you want to help people, support their own families or their friends and their own health. And so I tell my younger self, enjoy more of those simple moments, which I'm trying to do more of now. It's hard, as I just referenced, when you're in these opportunities that you feel are rare, particularly for people of color. You feel this impulse, this kind of immigrant mentality. You got to keep working hard. And as a result, you might achieve some success in that professional realm, but you miss out on some of those moments. I value them now more than I used to. And I think the pandemic helped me realize that.
That's very, very honest. And I think a lot of people can relate to that. Myself is included, having had sick parents, and you're like, wow, you have to show up more now, which is important. So thank you, Kyu. Like, this has been a really insightful conversation. I honestly learned a lot about the world and, the corporate world and the public health world, but also you as a person. And I appreciate you being so honest and candid and open about your journey through your career and personal. So thank you for being on the show. This is really great. And if everyone's really interested in this content, make sure you like and subscribe, and also check out cvshealth.com to learn more about the amazing programs that they're working on. Thank you so much, Kyu.
Thank you, Ashley. Thanks, everyone.